Hello, this is part 7 of our systematic approach to ECGs. And in this section, we're going to focus on heart blocks. So let's get started. Heart blocks are divided into 3 types: first degree, second degree, and third degree. And in second degree, we have type 1 and type 2. Heart blocks occur at the AV node, or the atrioventricular node. Now, the normal conduction at the AV node does produce this small pause in electrical current, where you see the impulse starting at the SA node through the atria, small pause at the AV node, and then down the superhighways. In first degree heart block, what we see is the electrical current starts, goes through the atria to the AV node. There is a pause there at the AV node that's longer than usual. And during that pause, the electrical current still, despite that pause, the electrical current still is able to transmit through the AV node to the superhighways and depolarize the ventricle via the normal pathway. And how this looks on an ECG, or rhythm strip, is that you're going to have an increased PR interval, or distance between the beginning of your P wave and the beginning of your QRS complex. So a normal PR interval is anywhere from 120 to 200 milliseconds. Some people will say even 230 milliseconds. Anything greater than that would be considered an increased or prolonged PR interval. Our second degree type 1 heart block looks like this. In this case, you have your electrical impulse starting at the AV node. It goes to the AV node and then down the normal pathway. And it has a normal PR interval. The next beat comes along and it does the same thing, but it takes a longer pause or a longer amount of time to get through the AV node. So your PR interval increased there. It happens again and there's a long or very pronounced pause at the AV node, but that electrical current still is able to pass through the AV node and depolarize the ventricle. At some point though, that pause at the AV node is too long and that electrical impulse is not conducted to the ventricle. And what this looks like then is a dropped beat on your rhythm strip, or ECG, where you see the P wave, but there's no corresponding QRS complex. After that, the heart resets and you'll have a normal beat with a fairly normal PR interval again after that, and you reset the cycle. So the keys to identifying a second degree type 1 heart block is that the PR interval varies. The P waves are regularly spaced, but the QRS complexes are actually irregularly spaced because you have these dropped beats and you have this change in the PR interval over time. Now, a second degree type 2 heart block is a little bit different. In a second degree type 2 heart block, you have your normal conduction happening from the SA node to the AV node and then down the normal electrical pathway. And in this case, you're going along, you're conducting your electrical impulse through the AV node on a regular basis, and then all of a sudden one is blocked and does not conduct. The PR interval has remained the same up until that blocked conduction. And then after that, it resumes its normal conduction through the AV node. So what you'll see then on your ECG is that you'll have a normal appearing beat, and then at some point, you'll have a dropped beat where you have a P wave but no corresponding QRS. And this can happen at varying rates that you'll drop a beat. It's just a random dropping of beats that aren't conducted. In this case, the P waves again are regularly spaced, but the QRS complexes appear irregularly spaced because of these dropped beats. Now, the RR interval actually between the beats that are conducted stays the same, but because of the dropped beats, it has the appearance of that the QRS complexes are irregularly spaced. A third degree heart block, which is the most dangerous type of heart block, means that there's no communication now through the AV node, and that all electrical impulses coming from the atria are blocked in the AV node. So what you have is you have electrical activity going on in the atria and depolarizing the atria, but that electrical activity is not what's causing the depolarization of the ventricle. The ventricle is depolarizing via another route. That could be from a ventricular escape rhythm, if the electrical impulse is originating in the ventricle at some point, but most of the time it actually originates in the junction, so the AV node itself will initiate some electrical impulse. And so what you'll have here is complete dissociation between your P waves and your QRS complexes. And what that looks like is that your P waves, again, are regularly spaced, and your QRS complexes are regularly spaced, but there's no association between where the P waves are located and the QRS complexes are located. The QRS complexes in third-degree heart block can be narrow, they can be wide. It depends on what part of the ventricle or other part of the heart has taken over as the control center of the electrical activity. As I said, normally it's going to be the AV node itself, but it could also be somewhere in the ventricle, and if that's the case, you would see a wide complex QRS. So in summary, heart blocks. First and third degree heart blocks are regular and have regular QRS complexes. Second degree heart blocks have what appear to be irregular QRS complexes. And as we progress through from first, second degree type 1, and type 2, and then finally third degree, they are really in order of severity. So a first degree heart block is typically not considered concerning, but a third degree, and especially a second degree type 2, are considered very concerning that that patient may be at a high risk for a dysrhythmia and a complication due to that heart block. Thank you.